In this first video, we're going to be doing a hip pointer wrap. We're going to make a foam pad 1/2 inch thick, and ideally we'd have a plate so we can go around the tender area, which is on the iliac crest. We're going to take the ace wrap, we're going to wrap it around that foam pad with moderate tension, making sure to go around a couple times to encompass the full hip pointer pad that we place, and then we're going to secure it off with some PowerFlex tape. Our next taping technique is the knee compression wrap, and we're going to use a 6-inch double elastic wrap. We're going to start down at the base of the lower leg and use a cross-hatching pattern, starting with more compression located below the knee and then gradually loosening up on our compression as we get up past the knee and into the mid-thigh. We're going to continue this cross-hatching pattern to push the swelling that we have in that knee up towards the center of our body, and then we're going to finish off the wrap by using PowerFlex to hold it in place. This next wrap is for a hamstring strain. The thigh is going to be placed in extension while the heel is placed on a lift, and we're going to use a 6-inch single wrap. We're going to wrap it around starting above the knee and encompassing the entire hamstring group, sealing it off with a piece of PowerFlex. Our next wrap is for an adductor strain, and we're going to have the patient place their limb in an adducted state with their heel on the lift and then their toes internally rotated. We're going to place a 6-inch double elastic wrap going down from their knee, working our way back up towards the hip, making sure we come in contact with their hip bone and the ASIS on both sides. We're going to make sure our pull is going down towards the middle of their body and not outside, and we're going to repeat this process for a minimum of 2 turns around the hips, and we always want to end, if we don't have enough room for the tail, back on the thigh and seal it with PowerFlex. The patellar tendon tape is next, and for this we use a 1-inch roll of Tensoplast, and we're going to apply it directly over the patient's patellar tendon, making sure that we're not connecting the tape around the other end to cut off that circulation. So we're just going to overlap it with a few pieces one at a time, and then that'll be it. Next we have the hamstring tape, and what we're going to do is have the patient be placed in a slight degree of flexion with their heel on the lift, and then we're going to wrap some pre-wrap or apply the tape directly to their leg, depending on the patient, on both the thigh and then on the upper calf, and then we may also use a heel and lace pad to prevent the hairs on the back of their knee and the popliteal space from being pulled out from the tape as well. So we're going to apply the first few anchors. This can be done with white tape or with elasticon. Basically just going to wrap it around, making sure not to cut off their blood flow, but we also don't want it to be too loose where the tape slides down and doesn't do its job. So once we have that, then we're going to take the elasticon strips, and one of them, the first one, is going to be applied directly behind the leg. We're going to make sure that we apply that tape so it's being cut in the middle and then wrapped around both the upper thigh and then the calf as well. So we're pulling down, creating a hamstring for what the patient would have a lack thereof. Then we would do the same thing for 3 more pieces, except for these would go to the side of the thigh, making sure that we provide a different line of pull, and then what we do is we seal it all up with some more anchors over the top, both on the thigh and then on the calf, and then wrap it up. Next, we have the collateral knee tape, and the patient's position is very similar to what we did in the hamstring tape. So the thigh is slightly flexed with the leg placed in front and the heel on the lift. We're going to apply some pre-wrap or just apply the tape directly to the skin with a couple of those anchors, again, to stabilize the rest of the tape that needs to be attached to it. We're going to put that on the mid-thigh, and then just like we did in the hamstring tape, we're going to apply the same anchors down on the top portion of the calf. Now, with the collateral knee tape, we want to put the elasticon strips over the portion of the joint line to essentially protect the LCL and MCL, depending on which ligaments you're working with. So I take that piece of tape, going from one side of the thigh, crossing over the top of the patella portion, and then coming back towards the bottom of, towards the back of the calf. The next piece of tape goes in the front of the, right on the shin, and then towards the back of the thigh, creating an X motion around the leg. And what we're going to do is repeat that same process a couple times on each side, and then for our final touches, we're going to put 2 strips going vertically from the fibular head up to sort of in line with the IT band, and then the same on the opposite side, which would be the inside of the thigh. So we'd be pulling those from the lower leg up to the thigh, and then again we'd seal it off with the white tape or the elasticon to make sure everything stays in place. And that is the collateral knee tape. Finally, we have the McConnell PFJ taping for patellar instability. And what we're going to do is take some Leuco tape and glide the patella medially, stabilizing it with each piece. We're going to take 3 of them directly to the skin and overlap each other for stability.